So I am a general surgeon that did an extra year of fellowship training in benign and malignant diseases of the breast at Northwestern University. As a general surgeon, I was in an all-male group, and so a lot of women that came in with breast problems or breast cancer asked to see a female provider, and so by default, I had a lot of women in my practice, and so then it turned out that that was what I liked the best, and so then I chose to pursue a fellowship. The breast program here is certified through the American College of Surgeons as a breast center of excellence, so that requires us to meet several standards throughout the multidisciplinary care of breast cancer patients, from radiation oncology to medical oncology, pathology, surgery. So we've tried very hard to make sure that we meet all those standards. Some of the things that I offer are risk assessment. So I see a lot of high-risk women who don't have breast cancer who want to discuss their risk either related to their family history or their reproductive risk factors or a high-risk biopsy. We can do risk calculations about what is their risk of developing breast cancer in the future, and then discuss high-risk interventions in order to either lower their risk or try to prevent them from developing a breast cancer in the future. I also find the breast cancer field incredibly interesting. There is a ton of research and money that goes into breast cancer research and innovations, and so there's constantly new data coming out that provides better care for women, less invasive treatments and interventions, and so it's a very interesting field, very fast-moving. When a patient comes in, she'll have a consultation, so usually she'll meet with me first, and we'll talk about why she has come in for evaluation. I'll do a brief exam, and then we'll usually meet again in the consult room so we can talk about options. I try to make sure that we can offer all of the latest advances in breast cancer medicine, for example, placement of partial breast radiation catheters, minimally invasive breast biopsies, nipple-sparing mastectomies, any other latest advances in breast cancer medicine. One thing I think that people don't realize is that there is very compelling data in the breast cancer world for exercise. So there is data suggesting that healthy women who exercise have lower rates of breast cancer, and that breast cancer who exercise have lower rates of recurrence. So I try hard to convince my patients throughout the practice to exercise. So one of the most rewarding things that I do is taking care of breast cancer patients. It requires a coordination between multiple specialties across medicine. And because it's such a fast-moving field, you always have to make sure that you're aware of the latest trials that pertain to that person's particular situation. We try to offer in the office minimally invasive breast biopsies, and we place partial breast radiation catheters. We can do breast ultrasound in the office, as well as counsel them about all their treatment options. The good news is that most early-stage breast cancer patients are cured of their disease, so people come in with a lot of fears. Once they hear the word cancer, they're suddenly afraid of what treatment will be and whether they'll die of breast cancer. In general, though, early-stage breast cancer has an excellent prognosis, and most of those women are treated and cured.